heart failure to me was someone had passed of heart failure. It wasn't a living condition. But I was quickly made aware it wasn't a death sentence. And I think that's really important to know.
Contrary to what a lot of people think, heart failure doesn't mean that your heart is stopping and that you're dying today. But heart failure or heart function disease can be managed, and you can live well with heart failure.
Basically 2 long months in hospital, 12 days of them being in a coma. The doctors constantly giving us information, empowering us to deal with this tragedy. Also the cardiologists, the nurse practitioners, the nurses coming in, checking in constantly, making sure he was taking his medication. And you know, this is another thing that's so important with, I think, the Heart Function Clinic and also South Lake, is they keep trying until they get the right medicine that gets the best results. And the happiest day of my life was January 22nd. When they said he was strong enough to go home. So he did whatever he could. It was one step at a time. Sometimes he would just have to rest on my shoulder. But within a week and a half to 2 weeks, he was walking up those stairs.
Living with heart failure may be defined in different ways for patients. For some patients it means more time, but for the majority I would say it means a better quality of life. So being able to spend time with their family, being able to go on vacation, being able to get the jobs done that they really feel like they've left undone.
And he just got stronger and stronger every day. So from walking up the stairs, which took him a long time, to being able to go for a walk to the mailbox with the dog. You know, to be able to come to a point where, you know what, we wanted to go to the theater again. We were able to do that in April. End of April, we went to Mexico together. He had the time of his life. So we were traveling like we did before. We were doing all the things we love to do. All the renovation in the basement was done. The cottage was in order. He lived his life the way he wanted to. Little did I know then that really I'd only get 6 months. But that 6 months, we did everything on his bucket list.
Recognizing if you have 1 or 2 or 3 of the symptoms altogether, sort of checking those boxes of, am I short of breath on exertion? Do I have trouble lying flat? Have I noticed that my ankles are getting more swollen, or my pants are fitting differently because the girth of my tummy is bigger? If all of these things sound familiar to you, it's not nothing. It's important to go seek medical attention.
If you get it early enough, you can live with it. I had the pleasure, he had the pleasure of having 6 months. But if you pay attention to the early signs, it could be much longer than that.
Seek medical attention sooner rather than later. Don't dismiss the symptoms, don't ignore them. They are important, especially if they are getting progressive and they're worsening over time.
Because you really can live with heart failure. If you really listen to the doctors, if you work with the medication and you ensure that you follow the rules. Everybody had their vested interest in making sure that Guy was able to walk out of this hospital and get a new lease on life. And they did, and it happened. And I'm so proud of that and so thankful of that.